Hello, my name is Dr. Joanna Oda, and I'm an Associate Medical Officer of Health with Halton Region Public Health. Today we'll be connecting with local experts to answer your questions about the COVID-19 bivalent vaccine. Hopefully at the end of this, you'll have the information you need to make an informed decision.
So the bivalent COVID vaccine is not a new vaccine. It is an updated version of the original COVID-19 vaccine.
It protects us against both the original strain of COVID as well as the new circulating mutated strains of COVID.
Health Canada has approved these vaccines to be very effective and safe. In terms of side effects, they are very mild compared to getting the actual COVID-19 infection.
Most commonly, redness and soreness at the injection site, occasionally a mild fever or swollen lymph nodes. All these side effects tend to go away in 24 to 48 hours.
It is important to get boosted again, especially if it's been over 6 months since your original vaccine, or if it's been 3 to 6 months since getting the actual COVID-19 virus.
Boosters are not a new concept with vaccinations, and we apply the same science with other diseases. Whether it's hepatitis or influenza, we're trying to always update our protection with COVID, especially because the risk of COVID is still quite significant.
The bivalent vaccine is a booster vaccine, so anyone that's completed their primary series is eligible to get the booster vaccine.
Anyone eligible to receive the COVID vaccine should go ahead with it and get the bivalent version. Regardless of whether you've had COVID recently or had a vaccine, especially if it's been more than 6 months since your last vaccine, it's a great idea to get boosted.
However, there are certain people at greater risk of severe disease who are advised to get their bivalent booster 3 months after their last dose. These would include people over the age of 65, people who live in long-term care facilities, pregnant people, and people with immunocompromising conditions.
The most important thing that you can do to help guard against COVID-19 infections is to get vaccinated. It will help protect you as well as your loved ones and the community at large.
I strongly recommend that you stay up to date with your COVID-19 vaccines, and if that means you're due for your COVID-19 bivalent booster, that you go and get it as soon as you're able.
It's really easy to get your bivalent vaccine. You can go to any Halton vaccination clinic. You can make appointments at any of the participating pharmacies, as well as any participating family doctor's office. Please go out and get vaccinated.
A lot of people wonder that if they've recently had a COVID infection, whether they should still get their COVID vaccine. And the answer is yes.
If you had COVID-19, you do get active immunity, so your body will mount an immune response, and that immune response will be active for about 3 to 6 months. After that time period, it is important for you to get the vaccine so that we can still provide a good, strong, robust response in case you get infected again.
There's a lot of information out there about COVID infection and COVID vaccines, and my recommendation for anybody who has questions is to speak to their pharmacist or speak to their doctor or consult the public health resources that are available online.
We are expecting a challenging respiratory season this year, and the same way you get ready for winter by cleaning your gutters, putting on your winter tires, keeping yourself up to date with your COVID-19 boosters should be added to that list.